Hello, Dr. Abdullahi. Welcome to our interview today. Thanks for accepting my request.
It's my pleasure. Hi, Farrukh. How are you today?
I'm fine, thanks. What about you? How was your day?
Well, it's been quite hectic, very busy, but thanks for organizing this. I'm very excited about it.
Thanks. I'm happy more than you. So we can start, I guess, with there are some questions I prepared for you for today's interview.
Okay.
I'll be giving them one by
hmm
one, and uh, hopefully you can answer them. And yeah, that's it.
I'll do my best.
All right. So my first question is uh, is like this: what led you to the field of therapy and treatment?
Okay. Let me first briefly introduce myself. I am Dr. Abdullah. I've been working in the psychiatry for over like 5 years. If you ask me what led me to this field of therapy is my childhood dream. So if you know, our people are traditionally more concerned about like their physical health than their mental health. So if your mind is not healthy, like not in a healthy state, or it's crooked, and you can't think straight. So your decisions are determined by your mental health. Therefore, you have to be very mentally very strong, as much as like your physical condition. So I want to spread the awareness. I want to help people. That's why I chose this, field, this profession, and I'm very proud of it.
So you mentioned that you want to help people, and what about the other professions that can help people mentally? For example, you could have chosen to becoming a public speaker or something like that.
Well, that's a good question. I mean, that really depends on person's perspective, like what perspective they're looking at the future. Mine was like more like medication involved as well as like therapy. Like in psychology or in psychiatry, your therapy alone is not enough. You have to prescribe some medicine to help with the mental state of the patient. So sometimes, like for their relaxation, calming down, or like to decrease the intensity or density or intensity, or their anxiety, their stress levels, depression. Everything is like everything happens in your mind is like the mixture of different types of chemicals. Uh, you know, uh, Happening in your mind. So it's the balance of like words and treatments, like the medicine. Therefore, I chose to be this profession, psychiatrist.
I see. So yeah, my question was a little silly to be honest, because public speech is totally different thing compared to treatment. It's more like a motivation to people or
Mm-hmm.
leading to them in their
Oh yeah.
career, for example.
Mm-hmm.
So yeah, so I guess we can move to the next question if you are okay.
Okay.
Um,
Yeah, yeah.
so question goes like this: what is your psychotherapy theory?
Psychotherapy theory.
Yeah.
Okay. So my method, my theory is more about listening, like listening to the customers, the clients. what we call clients.
Yeah.
So you see some professionals when they're interviewing or listening to their patients, they usually intervene. They abrupt the conversation. So, but my method is if I'm going to have a conversation with you, I'm going to listen to you fully until you finish your whole, thoughts, your ideas, your concerns, your beliefs, whatever comes out of you, I'm going to listen to it because I want everything that's inside of you to come out. I want to know your deepest feelings, deepest thoughts, and then I'll draw my map, my therapy based on your behavior. So, but from the conceptual point of view, my method is called behavioral. So it focuses on observable behaviors and learning principles to modify, your undesirable behaviors and inquire the new desired ones. So in one simple words, I'm going to listen to you and see what kind of flaws, what kind of, bad traits of your character behavior are, and then I'm going to try to get rid of them. Okay, so for example, I can give you some examples. Like they're more like technical words, but still exposure therapy, operant conditioning, applied behavioral analysis. There are so many, but you have to be able to read those concepts and be able to understand. But I don't want to take your time to explain those very long theories. They're boring.
I don't think I would be able to understand them anyway.
Good point.
You said that you try to listen to your clients more, but what about if their mental flow is actually not being able to express their feelings and what's inside them? What would you do in that situation? You can't get them talk, for example.
Nice, very good question. I like it. You see, out of 10 people, let's say out of 10 clients, if you can make 7 or 8 speak, there's definitely going to be 1 or 2 who are not willing to speak, or at least they're willing, but they cannot express their feelings.
Yeah.
Now, in psychiatry, in psychology, there are methods to make them speak, or at least even if they cannot speak, you can exchange the ideas using some type of gestures, right? Yeah. So it's different. You have to find the right spot. You have to find the right method. But it's different for everybody. But there are some other methods of communication to get everything out of them.
Oh, well, it's clear. Thanks. So it was all for the second question. So we can move on.
Okay.
So the next question is, would you please share a significant or memorable experience of yours in the process of being a therapist? So far in your experience.
Yeah, there have been so many cases, interesting, scary, a lot of different cases. But the one of the most memorable one I never forget was about the kid who got ADHD. So he was about 14, 15 years old, a kid, but he acted like 7, 8-year-old guy, like young kids. And the parents were very concerned that he will never grow up in the future, grow up like his peers. So they brought him to me. They wanted him to behave like normal to his age. So I had to spend probably 18 months, 1.5 years to help him. At first, we started with some medications, of course, to stabilize his behavior, because kids with ADHD can be very different, energetic, or very rebellious. And then I, organized some individual sessions. In a couple of months, I was able to separate the teenager from the screen he was addicted to. He was really addicted to, different shows on YouTube, all those platforms. But I was able to get him out of that. And then in a year time, he started paying attention to his surroundings. He started talking to people actually. And after 18 months, he had a very cognitive conversation with others, which made me very proud. The parents were very happy that he actually made some progress, and he started acting like more normal to his age. So I still remember him. I'm in touch with most of my clients who got really well after the sessions, and he's one of them, and I'm very proud of my work.
Yeah, as you mentioned, most of the how can I say, Z generation is all of them almost are addicted to screens or something,
Yes.
new stuff like that, and
Yes.
that's why most of them has ADHD or related problems.
Yes.
And
What we call them Generation Z problems.
yeah,
Okay.
so you said you were able to like detach him from the screen, and how could you do this? How did you manage to remove screens from his life, let's say?
First of all, you have to, I mean, it's not that easy. It doesn't happen overnight. It doesn't happen over a
Yeah.
couple of sessions. It
How,
takes
how
a
long
lot of,
did it take? Yeah.
I think it took me like 3 to 4 months.
That's
There are methods. When you're doing it, you got to be very careful. You don't want to scare the kid. You don't want to make him, afraid of you. So you got to be really careful. But there are methods too. So you have to apply those psychiatric methods to be able to communicate with him. Find his interests, find his, weak points, and slowly get him out of the virtual reality he is living in. But it was like very long procedure. I mean, I can't explain it with one word, to be honest with you, because it's like you use some methods. So it's a long process. But
so. Actually, my guess was you found something that can be alternative to those screens, some other activities, for example, without
yes,
screens.
yes,
That's
yes, like
pretty cool.
more like interpersonal, communication is probably one of the most beneficial methods to get them out, like some interactive games. So I mean, it's different for everybody again, depending on their character, depending on their personal traits. But yeah.
Yeah, actually, thanks. So let's move on to the next question then.
Okay.
With whom do you specialize or have a preference for working?
From my clients, right?
Yeah.
Okay. I mean, I don't have any preference. A patient is a patient. It doesn't matter, no matter what their age is, no matter what their gender is. What is important is their willingness to change, as well as their atmosphere, their environment. For example, especially their families. For example, if you try as a therapist, but your client is not willing to do it, it's kind of like useless. I would say, like, or you try and your client tries, but their family is actually not really doing anything helpful, then it's kind of going waste, like you're actually wasting your time. So when I do something, I personally talk to their families, and I talk to the patient individually, try to do everything in harmony. If everybody tries, if everybody, pitches in something, I mean, a little bit, then everything is going to be way faster, more effective. Correct? So
Yeah.
Because sometimes I give all my energy to my client, but as soon as they go back home, they go back into that repeated, lifestyle, and that's a waste of effort. So, but I'm going to tell you frankly, it's easier to work with the younger generation than the elders, because elders are like mostly stubborn sometimes. Like it's really hard to put something in their mind, in their brains, because they're like
Instead, they
what
try
they
to
consider is
change
right
it.
is going to stay right for the rest of their lives. They're like, they don't want to admit some things, like they consider themselves wise. So it's like really hard to actually try to iterate something.
All people actually try to teach to you instead.
Yes, they try to teach you like,
Put
no,
their
you're
own
doing this
ideas
wrong.
into you.
Let me tell you how to do this exactly. So you're like, am I the doctor, or you are the doctor? So it's like, it's a difficult situation.
So, briefly, so the clients also should be willing to get treated in order to your treatments work, right?
Exactly.
Yeah, I see.
It's like mutual understanding.
Yeah, they need to cooperate and work together.
Yeah, cooperate. Yes, right, correct, absolutely.
I see. That's great. But were there any case that you could not help the client because of their inactivity throughout the therapy?
Oh yeah, there have been plenty of cases where I let the clients go. I would be like sessions, and if I don't see any effect, I'd be like, I'm going to be honest, sir, madam, I'm so sorry, but I don't think you're willing to cooperate, or I don't think I see any progress from your side. I'm doing my best, but whatever assignments I'm trying to give you, you're just simply rejecting it. So I'm going to have to let you go. I mean, sometimes they complain, sometimes they're like, they try to promise you, but I mean, it's clear from the first couple of sessions. So like, but I admit it. I don't hide it. Some psychiatrists or psychologists, they're like, if they have some type of failure, they're like, they try to hide it because it's going to affect their reputation. But I don't care about it. As long as my client is cooperating, is willing to work together, then I am down. But otherwise, I'm sorry, I have to say goodbye.
So you don't want to waste your time and waste the client's
Oh
time,
yes,
right?
it's look, it's hourly payments, right? So you sit down with them, you talk to them. Every hour counts. So you're taking this responsibility. So you're responsible for each hour. You want it to be effective. You want it to be useful for them. You want to treat them. But if it's not going to work, why waste your time and their time, right?
Yeah, that's great. But most of the therapists are just working for money, and you know,
I mean,
seeing.
yeah, man. You can always find some. You can always find some. Depends on how professional they are. But I know many very professional therapists. Like I have some friends, they're like very responsible, and I've seen some cases where one of my colleague used to work together in one of the medical centers. He actually had some fights, like not like physical fights, but more like arguments with the clients. He would be like yelling at them and kicking them out of his office, like trying to express how concerned he is. But some people don't understand that. It's different.
Yeah, I see. So the next question then, uh, what are some of the most common problems your clients face in your practice?
Since we're in the psychological field, it's mostly stress, depression, that creates all the problems. That's the underlying problem. Sometimes I meet clients with more serious, issues like bipolar or borderline disorders. These are like psychological illnesses, or even like sometimes you may meet, like you may come across with schizophrenic clients. It's really different. Their mood swings every second, and it's hard to they're going to do, what they're going to say. You have to be patient with them. You have to be careful too. I had some cases where my clients actually charged at me. They attacked me during the sessions, and I definitely got scared. But I have even thought of quitting my job. But as you live, you see different people, and you're like, I have been in the worst case. I mean, I've been in the worst cases. So I'm gonna do this. So like this motivation and good clients actually holds you back, like very tight in this profession. But it's different, man. Mostly like psychological issues.
Uh, so, um, so how can you actually differentiate client's problem if it's uh, requires treatment with medicine in hospitals? You know what I mean? It's more serious that you can help
Oh,
them. How
oh
can you
yeah.
differentiate it?
Okay, okay. So when you come as a client, you don't directly go into the room and start speaking. That's not the case. That's not going to happen. When you, as a client, come to the office, first thing you're gonna go through is it's the application process. You go through the survey that actually checks the sanity of you, like how sane you are. But if we're going to see any signs of insanity, you are going to be directed to more institutionalized centers, because we can't take you as a client, because we don't want to be responsible for your well-being. You know what I'm saying?
Me? No, no,
Or
I don't need a
other people.
therapist, bro.
What is it?
I don't need a therapist, bro.
No, no, no. I'm saying, like, different people come, and you check them, and during this, surveys, you actually I had some cases where my clients were like in a very damaged case, or psychological cases. So I had to actually contact different institutions to get help for them, and you have to deliver this message in person. Like, you have to be like, excuse me, sir or madam, I'm sorry, but I'm seeing more serious, type of disease in you. It's not just only like mental. It's more like physical as well. You gotta treat it in a different facility under supervision of doctors. It's hard, man. You see all these people. Sometimes you think like, am I going to go insane one day like this? And you have these doubts, but these are there are methods, sure.
I see. So, thanks for the answer.
Hmm.
All right, my next question is how do you create a therapeutic rapport and alliance with your clients? Uh, you got the
Um,
answer, right? Yeah.
from Yeah, yeah, yeah. I got you. From the technical point, I prefer using like my laptop. I usually listen to my client, and during my listening, I usually take the most important notes. Some professionals use notepads, books or like that. Some use like more of a recording, voice recorders, stuff like that. Different devices. It's different for everybody. But if you ask me how I engage with my clients, then there are some scientific methods for that. For example, active listening and communication, or there are collaborative goal setting, or cultural sensitivity, maintaining, professional boundaries. There are, steps and methods. And feedback is also my strong suit. Like after I treat my clients, after they are done with the sessions, I usually ask for feedback. Like, how was your set? Did you like it? Were you satisfied? All these, methods actually help you to alliance, to ally with your clients, build the alliance.
I see. So it's like a question out of curiosity, but does your methods of taking notes affect the answers of the patient, your client? I mean,
Me.
no. If you are, for example, recording the conversation, they might hold back some things in their mind.
Oh, okay. I get your point. Yeah. Okay. Sorry. Let me answer this. There's a therapist-client confidentiality between you and the client. So whatever they say has to be between you and the client only.
There's a contract, some sort.
Yes, most definitely. Most definitely. If you break the rule, if you go and tell your family or your friends or some other people about your client's personal information, this is like crime. You're going to be sued by the client, and you don't want that. You don't want all those, court cases. Your reputation is going to be ruined, and you will never be able to do other sessions with other clients, because this is going to actually damage your career. So you have to be really careful.
All right, I see. So all right, thanks for the answer, and we can move on.
Okay.
All right, next question. It goes like this. What are the methods that you generally employ in your practice? Like, I know you mentioned it before, but now we can go deeper into this topic, I think.
Okay. I use all types, depending on the client. I mostly employ talk therapy. Sometimes I use electroconvulsive methods as well. Well, whatever I use, I try to use the softer touch, which means you got to be careful with the client. Whatever word you say, whatever is coming out of your mouth, you have to be careful, because when clients come, they come with the problems. They come with they're like troubled. They need help. They're like looking at you like you do something for them. So you got to be really careful, and you have to be sympathetic. You have to feel their pain in your own body, in your own heart, and you must listen, as I said previously, and feel their pain. That's basically I think the most effective method or key to a successful therapeutic session.
Does your clients' problems ever affected your mental state? Like, after hearing their problems, have you ever thought about it for like some period of time?
That is the question I usually expect, but I never get from the interviewers. Well, in the beginning, when I started my career, it did. I had some cases where I had like headache after the conversation and spend my whole day in like stress. I'd be like thinking about my client, worried, concerned about his or her problems. And then my whole day would be like ruined. I would be like oh my God, how am I going to do it? How is he going to do it? Are we going to be able to, overcome these problems? And this would give me like, chills, and I would be like very concerned. But as time goes, I have seen more and more. I've seen very serious cases, and it kind of desynthesized me, which means I am more like looking at it objectively. I'm looking at it as a third party, and I'm not actually thinking like from the personal view or personal perspective, but as a professional, as a doctor. So this actually is helping me to actually not to take them close to my heart. Otherwise, you're gonna get sick, man. You're gonna get really depress yourself. You don't want that in your life. You have family. I mean, I have my family. I have my own problems. I have my own concerns. And on top of that, I don't want any other issues. Whatever is at work, it's going to be left. I don't bring anything into my house.
Yeah, I asked this question for a reason actually. Um, so their problems does not affect your mood, but your mood definitely affect them, right? Uh,
Then clients,
yeah,
right?
yeah.
Oh yes.
So,
Oh yes.
so is there any method that only uses mental state, their client's mood to uh, flip their problems in a good way, like without any other extra, efforts. I mean, only just
Could
by
you
conversation,
elaborate your
like you're in a good mood, for example,
Yes.
and then the client is telling their problems, but just by looking at you,
You're
by
smiling.
talking to you, and did it ever help the clients? Like, is it one method itself? I mean, could I give you the right question?
Well, I think I kind of got you. Whatever, no matter what state you are in, once you close that door of your room where you talk to the client, where you actually treat the client, you have to be in the, I would say, like balanced mood. I mean, yeah, you may have a really good day or you may have a really, ruined day, but it doesn't matter. After I close the door, I have to be like with the zero attitude. You know what I'm saying? Like
Yeah.
I can't show them what's going on in my personal life, because imagine like your client is crying and telling you something, and then you're smiling here, sitting down, can't stop, can't hold back. This is going to give them the impression that you actually don't care. You don't want that, right? So you want them to, if they're concerned, if they're really depressed or sad or crying, you don't want to be like, I don't want to be laughing. You don't want to be like smirking. They want to see their concern in your eyes. So you have to show the empathy, right?
Yeah. All right. I got it. Thanks. So, all right. Let me ask you the next question then.
Yes.
What is your approach to customizing for individual clients? How do you uh, approach for each individual patient, let's say?
I would say like with one word, time. So I take some longer times compared to other professionals to choose a specific method or approach, because if I choose something fast without further thinking, then I'm afraid that something's going to go wrong. I don't want that. I want to take a longer time. I want to listen to them fully until they actually express everything they have in their minds, and then try to come up with a solution. And therefore, time is I mean, not even time, but I would reword it to like patience.
Yeah.
Wait,
So you
wait.
take time to learn the
Yes,
patient first.
the whole picture, the whole picture.
Yeah.
I don't want to miss any,
Details.
aspect of their behavior where I can actually deliver my method through. So it's going to take a lot of time, patience.
Oh, I see. So can you provide an example of a difficult case and how you managed it?
Oh, that's a really difficult question. Yes, I can give you an example where I met suicide attempted girl.
Oh, really?
So she was, yeah, she was molested by a group of guys who were the friends of his boyfriend, and that was a really horrible case.
That,
I
that's
had to
even
rebuild the,
that's even
what is
horrible.
it?
That's even horrible to listen to this story.
I know, right? But I see a smile in your face. I'm like, you are not going to be a good therapist. So I'm
I'm
joking.
just trying to be.
Anyways, I had to rebuild trust for men because I'm a man, right? So she comes to me and seeking therapy. So I had to rebuild this trust between her and the man, and it took me like 2 years, to be honest. We worked with her for over 2 years. Every session was struggle in the beginning. Like it was really hard. She would be like crying nonstop. I was traumatized myself. I mean, but thanks to the cognitive behavior therapy, I actually managed to get her out of depression and suicide thoughts. She actually didn't give up suicidal thoughts until she was in the therapy for 6 months. But after that, she got better and better. After 2 years, she actually, I would say, like fully recovered from the trauma in her life. And what makes me really happy is she is actually married now, and she has 2 children now. And she still calls me when she's down or when she's sad. And I mean, as a professional, of course, she has a beautiful family, and I can't be more than happy for her. I am very proud of her.
Uh, but that's a great story, actually. No,
Yeah, I mean,
not the suicide part, but more therapy part.
of course, of course. I mean, if you imagine, you don't want that kind of stuff happen to you, to your sister, to your family
Yes.
member, to your daughter. That's a tragedy. That's a tragedy. Sorry.
Yeah, yeah,
I mean, that's horrible.
of course. So let's move to the next question about the
Okay.
horrible things. Uh,
Okay.
right. What is your way of getting the recent news regarding research and developments in your area of specialization? Specialization. Sorry.
Specialization. Okay, okay, I see. Well, mostly academic journals, and I have several subscriptions to worldly known journals, publications. I also read a lot on the internet, but finding a reliable source is an issue on the internet because many people can type, many people can bring many things, and most of the articles on the internet on psychology, psychiatry is actually garbage,
Yeah.
unfortunately. But you can actually find a lot of really reliable sources on academic websites.
So is it the comfortable way for you? I know it's easier via internet, but isn't it like more more comfortable with like listening and watching some
No,
interviews?
no, no. I think you got me wrong. I don't spend a lot of time on the internet to read, to get the news in my field, in my profession. I actually read academic journals where scientists actually publish news articles, changes. What I'm saying is sometimes I open the internet, I try to read something, I try to listen to something. I mean, not everything is garbage for sure, but most of the stuff is garbage. So I prefer reading the journals, academic journals, not online, offline. I have subscriptions, I get mails every day into my house. I open them, I read them like, traditional, like guy, scientist. So that's how I challenge my knowledge in my field.
I say I got your point. Thanks.
Mm-hmm.
So, next question is, what do you regard as the most important ethical considerations in your practice?
Yeah, that's a very good question. Two things. The first one is boundaries between client and the therapist. What I mean is like I have never had personal affair with any of my clients. You can't be like lovers. You can't be friends. That's against rules. Everything is at the professional level. I don't want to lose my clients. You know what I'm saying? I don't want to lose my reputation. Another most important thing is client confidentiality. I think I already told you.
Yeah.
You can't say a word. You can't say a word about your client to any other parties. No, none, zero. Or you will lose your certification, you will lose your license, you will lose your career. That's for sure. That's a crime. So you have to be really careful. That's against my moral, ethical codes.
Yes, I see. It's actually a crime for every profession because the data is the most uh, expensive thing right now.
Oh yeah. Oh yeah.
Yeah. So thanks for the answer. That was
No
crystal clear.
problem.
All right. I'm gonna give the next question then.
Okay.
What strategies do you employ to ensure your self-care and prevent burnout while playing the role of a therapist, like during the therapy process?
That is very controversial. Not like controversial, I would say, like, but very problematic part of my job
Yeah.
because you easily burn out, you get stressed.
Actually
Yeah.
mentioned earlier that you put your mood into zero, and before the therapy, I mean. I think
Yes.
it's related to this
Well,
question.
yes, I do it by taking occasional holidays. I take holidays 4 times a year. And in this job, it's easy to go insane. You may lose your sanity. So I pack my luggage and take my wife, take my kids, and go to different places. Sometimes we go to the beach. Sometimes we go to the road trips, or even sometimes we go to international travels once a year. So this actually helps me to refresh my brain, refresh my thoughts, and forget about the job, forget about the clients, everything, and then go back as fresh as
As
I can.
fresh therapist.
Yes.
So was there actually any case that you like burned out during the therapy process?
It happens a lot. It happens a lot. I can tell you one or two cases where I actually felt really stressed because one time I had like 4 sessions scheduled back to back in one day, and each is like one up to 2 hours long. So by the end of the fourth session, I was like morally like
Tired. Yeah.
knocked down. I was like done. I was tired. But the thing is, I can't easily just cancel my appointment. It's against professional codes. It's against my ethical codes. So I had to do it. I had to put up with whatever my client has, and be patient and listen to and give them as much advice as I can, and get over with it. So, but I mean that happens a lot, to be honest. Especially like if you have like really busy day, and schedules are back to back, and you have a lot of clients. This may happen occasionally.
I see. All right, thanks. So, what would you recommend to someone who's seeking therapy or treatment for the first time? For example, me, I've never took any treatment or therapy process. I thought I don't need them, but currently I'm very stressed, to be honest, and I have ADHD, I think. I can't focus
Okay.
on my tasks.
Focus, yeah. Focusing is, yeah. I know. Okay, so what I recommend is don't be shy, and do not own it. Do not delay it. If you think you need professional therapy, go for it. Okay, so don't postpone it. I know a lot of people are ashamed of things that happen to them, and but only it makes it worse. So talk to professionals and get help.
So, if you would be okay with it, I can make an appointment with you.
Oh yeah, okay, no problem.
That would be
I'm
great.
down.
All right, thanks for the advices. Um,
Hmm.
could you explain how you apply cultural competency to your work?
Well, I already answered. I partly answered this question. Displaying the cultural competence behaviors of actively demonstrating empathy and effective engagement is important. When moving beyond the tolerance. These three components will actually help us, to create a welcoming environment, and establish an appreciation of similarities and differences among us, among cultures. These are three basic fundamentals.
What about nationality? Like, do you have to learn each and every nationality and their personalities in order to adapt to the clients? Like,
Oh yes, for sure. I mean, every tiny factor plays important role, and you have to pull as much information as you can, and you have to build this, theory during the therapy session. And as I said, you have to be patient, wait for every detail to come out, and then based on their whatever factor is it, whether it's nationality, whether it's culture, whether it's beliefs, preferences, you have to take everything into account. It's very important.
all right, I see. Thanks. So, I think it's the last question for this interview.
Okay.
Can you tell me whether you are currently undertaking any training, professional development activities, or certifications?
Current right now, no. I already have gotten American Board of Medical Specialties certification. That's ABMS. What I am trying to do now is to get a PhD in psychology. But I mean, it's been 5 years since I graduated my master's degree in psychology, and I think I have gained enough experience during these 5 years to go to the highest degree in psychology. But as you know, it takes a lot of time. It's like at least 5, 6 years of research, information, getting a new knowledge, getting new information. So it's a lot. It's a commitment. So, and also it's a financial commitment. I need to invest in my knowledge. So I think I can definitely handle it now because I've seen different clients, I've seen different cases. Now I can build my theories on the cases that I have learned. Do some empirical research, do some experimental research, and create some new theories, I would say, in this field. So I think I'm ready for it.
All right, that's great. But do you think it's important to get educated to become a therapist? I mean, the degrees, for example, master's degree. There are several courses online that are giving certifications and people becoming a therapist. I saw some case like that.
Nah, I don't think you can be a therapist getting a 3 month long certification. That's impossible. That's not what you think it is. To be a treating professional, you have to actually graduate a tertiary education, which is a university or a college, because you have to get a medical degree to do that. You don't want to be responsible for someone's life because someone's life is in your hand. Imagine somebody comes to your session, next day they hang themselves, they die, and they're about to arrest you because you had a session one day ago. Are you ready to do that? Do you want to go to jail? I don't think so. So it's a very serious profession. You have to take it really seriously. Otherwise, you will see the consequences. So,
All right, I got it. I'm not willing to be one, but it was just
Oh
interesting.
yeah, for suggestion for people who are actually thinking about going to this field is get education in the first place, to get a relevant degree, certifications, all these diplomas, qualifications, and then go for it.
I see. So thanks for the answer for this one too.
No
And
problem.
that was the last question, as I mentioned. And
Okay.
for the summary, can you give some more advices to people, for example, want to be a therapist, let's say, who's
Who
planning?
want to be a therapist?
Yeah,
Okay, okay. If you want to be a therapist, you have to feel that way. You can't be like, okay, I think it's like therapists are making really good money. I think I'm going to do it for money now. You have to be able to feel someone's um, affected brain, someone's affected heart, and feel it in your own heart, in your own, brain, and feel the empathy, feel the hurting feelings, and do it as if that person is actually your family member.
mm,
Otherwise, you will not succeed. That's at least my theory. That's my approach of how I actually treat my clients. I mean, it's hard.
yeah. As you mentioned, you have to be willing to help people, like you,
Yes.
right?
Yes.
All right. So thanks for the advices, and
No
I think
problem.
we can now end our interview. It was very great and
Hmm.
informative. Uh, yeah, thanks for your time. Thanks for
No
accepting my
problem.
request.
Thank you so much for inviting me, and I hope to see you again in the future interviews. And good luck with your studies.
Yeah, thanks. I think you'll see me in a therapy session of yours.
Oh yes. Okay. Have a good one. Bye bye.
Thanks. Have a wonderful day. See ya.
Thank you. You too. Bye.